So Chad, can you go ahead and start the webinar, please?
Is now starting. All attendees are in listen-only mode.
All right, it sounds like we're all up here on YouTube, Facebook, and the GoToWebinar today. Good afternoon, everyone, and welcome to the Maricopa County News Conference for April 17th from the Unified Command. I'm Fields Mosley. I'm the Communications Director for Maricopa County, and I'm considered the lead PIO, Public Information Officer, during this reaction to the pandemic and running the Joint Information Center for Unified Command. So thank you to all our friends who are joining us via YouTube and via Facebook, and also all our friends in the media that have decided to join us today via the webinar to ask your questions. We, of course, will do our best to answer all those questions. If we can't get to a question or if we don't have the right expertise in the room, we'll, of course, address that question later via email or a phone call. So today's topic is one that's near and dear to our hearts here at Maricopa County. We're talking about helping people who are experiencing homelessness during this time in our community. This is an area Maricopa County is involved in as a funder and as a leader at all times. But I want to be clear, we are not alone in any of these efforts. There are dozens of organizations and governments that are wrestling with this issue at the county level and the nationwide level as well. Bruce Liggett is the director of our Human Services Department here at Maricopa County. His department helps people with many, many different things, but those include rental assistance, help for seniors in our community, also finding people jobs. And in this case, we're talking about the issue of homelessness. Housing is a very important component to what our Human Services Department does. We'll also have Marcy Flanagan. She is our Director of Public Health. She'll be here to answer any questions in the public health vein. So members of the media, if you've been a part of our news conferences before, you know the drill. We will have our moderator who is on, that is Chad Amos. He's one of our PIOs. He will open up your microphone when you raise your hand virtually in that GoToWebinar. And please note, if you have your hand raised, please unmute your microphone, and then we will unmute you on our end to allow you to ask a question. Please ask one question. We're always able to get back to second questions, it seems, so please ask one question at a time and we'll get your questions answered as best we can. So a couple of reporters last time had some difficulty with GoToWebinar. I want to cover this very quickly. If you're having difficulty, please don't keep clicking the mouse or touching your screen or however you're joining us. If you continue to do that, the program cannot catch up and we cannot help you. So if you're ultimately not able to get your hand raised and get your mic unmuted, log out and log back into the GoToWebinar, and we'll try to catch up with you there. Otherwise, we'll follow up with you a little bit later from the Joint Information Center. So with that, I want to welcome Bruce Liggett. This is the first time joining us for one of these press conferences. And again, Bruce Liggett is our Director of Human Services here at Maricopa County.
Thanks, Fields, and good afternoon. Wanted to share with you this afternoon some of our plans and our progress we've made addressing the homelessness and people who are homeless in terms of the COVID crisis. So the Human Services Department is part of the overall Maricopa County Unified Command, and that's to ensure that our actions are guided by public health and public health data and are coordinated with all the operational and logistical pieces going on in the county. As Fields said, I want to reiterate that virtually everything I mentioned today represents a coordinated effort by multiple agencies across the state. And in special, I want to call out 3 regional entities that provide services throughout the county: Circle the City, the healthcare for the homeless provider, Community Bridges, and the Human Services Campus. Our collective work can be summarized in 2 major goals. 1, reducing the risk among the most vulnerable of the homeless population. And 2nd, preparing for and responding to individuals who have symptoms, need isolation, or medical care. So in terms of reducing people at risk, we want to reduce their exposure. People who are homeless are challenged to be able to social distance. Many people in shelters have beds that are really close by each other. So what we did first, our initial priority was the Human Services Campus in downtown Phoenix. That was obvious because there's over 800 different people every day who access that campus. And we worked with the campus to put in screening protocols. As people came into the campus, they were asked questions about whether they had a fever, whether they knew somebody who was exposed, and based on that, they were medically triaged if the answers were yes to any of those. So that was the first step we did. The campus themselves started putting additional toilets and showers. The county provided hand washing stations for the campus. With public health support, we provided over 15,000 masks for homeless providers and their staff and the clients to be able to use. Service providers have been reaching out to unsheltered people. I know there have been a lot of questions about what about people who are on the street. And so there are providers who do outreach, engage people, go to encampments, and they've been sharing information about the coronavirus, what you can do to prevent the spread. That's been happening. In addition, part of the campus identified an area where 47 individuals from the largest shelter in the state, Cass, were moved to be more isolated from the rest of the population because they were vulnerable, they were seniors, or they had other compromising health conditions. Next Monday, we're going to begin a transfer of 48 additional high-risk individuals to get them out of congested congregate settings into more private areas in a facility we've leased in the East Valley. So 48 people, that'll begin on Monday. The Center for Disease Control has made it very clear that encampments should not be broken up, but rather we should work with encampments to make sure they're practicing social distancing. So next week, we are going to be implementing a voluntary tent distancing plan. It's going to create a safe outdoor space for people who are now around the Human Service campus. As Phil says, we estimate there's 320 tents there, probably with 600, 700 people. And the tents are sometimes large, they're close together. And what we're going to offer people is the opportunity to move into county parking lots that have been measured off and have already had painted lines drawn in 12 by 12 foot squares where we can put people, and that again is a CDC recommendation for how we do this. We put people in there, they will have access to their own hand washing stations and toilet facilities. And we've moved dumpsters in the area. So we're preparing this, and this is going to begin to phase in over the next week. We think that each lot, we're going to start with maybe, we have 2 lots. They could hold with the 12 by 12 foot measuring up to 88 people. We're going to try 44 in each and see how that goes. This is new and this is uncertain for us. I spoke to individuals around the campus just this morning on the street who indicated they were excited about the opportunity to move. So this will be quite a challenge to do. In terms of responding to people who may be sick with the virus, that are homeless populations, we want to provide appropriate temporary medical care for people with symptoms under investigation, maybe positive, who do not require hospitalization or hospital discharges. So we are establishing some alternate care sites, and it's been a complicated process. There's been a lot of discussion about use of hotels, but we had some of the parameters we had to consider, which was the number we would need. We were looking for areas that we could own large blocks of continuous rooms, some that would be ADA available to people. So there are a number of considerations that went into selecting the hotel. And we're fortunate to, again, have our regional providers help with staffing those facilities, providing supplies, and the transportation too. So again, you can see the operational challenge. In terms of medical related alternate facilities, we already know that Circle the City has 50 beds in their facility on the campus. They've expanded to 48 additional beds with tents, medical tents, by their facility. We have reached an agreement with a hotel in downtown Phoenix with 28 beds that'll be primarily used for people with symptoms or under investigation or needing some kind of medical supervision. The proximity to the campus and Circle the City's other medical respite facilities are what led to that decision. We also have identified a facility, have not yet signed an agreement, but it's in downtown Phoenix for another 25 beds that'll initially be used for at-risk populations, but will be available if the number of people who are potentially infected need that type of care. We are planning to establish a medical triage hotline next week where people who work with the homeless, whether they're shelters, whether they're doing some outreach, or whether they're hospitals, could have a number to call and help get medical advice about what's the right step for that person. So in terms of the overall system, we've either rearranged facilities or entered into leases to add almost 200 new beds for people dedicated to this crisis. Fortunately, we're not aware of any significant outbreaks among the homeless at this time. Our efforts, we know, are temporary as long as the crisis exists, yet we're going to use every opportunity we have working with these people to work on their permanent solutions, which is housing, to further engage them and to give them the support they need to be able to move on and be self-sustaining. So I'm grateful to the support of the County Board of Supervisors and the county manager and the public health staff who've been so helpful to everything we do. Thank you.
All right, thank you so much, Bruce. Appreciate it. That was a lot of information for all of you to digest. I know I've visited with many reporters out there about some of our plans and kind of giving you a high-level view of this, but certainly Bruce is deep into the details and he's provided a lot of context here for the information I've already provided. So with that, we'll go to questions now from the reporters who are on the line, and Chad is moderating that today. Chad, do we have a question?
I have a question from Leon Gonzalez. Leon, your microphone is live.
Hi, thank you for your time. Just, I was wondering if there was a detected case on the homeless community. I know that already said that there's not an outbreak, but if there was a case detected on the homeless community. Thank you.
We're not identifying individual cases or discussing individual cases. Circle the City is the healthcare provider for people experiencing homelessness, and they obviously have a spot as well as the overflow that Bruce discussed there at the campus. They will be conducting testing as testing is warranted, or people might be getting tested in hospitals or other places. But many of you have asked for answers about specific congregate locations, whether it's a hospital, a long-term care facility, or the Human Services campus. That is not how we discuss information. If a person tests positive, they will be a part of our overall statistics regarding people that have tested positive for COVID-19. Do we have another question, Chad?
We do not.
So I'll give it a couple more minutes. As a reminder, we do have Marcy Flanagan, the Director of Public Health, here as well. If you have questions on this Friday about anything regarding public health related questions.
Leon does have a follow-up. Leon?
Go ahead.
No, my question was already answered. Thank you.
Okay.
There are no others.
All right, I'm going to pause momentarily if we have no other questions. I know sometimes we've had difficulty with the GoToWebinar, people trying to come in via various devices. So if you still want to get a question in and you're a member of the news media, this is your opportunity. So we'll give you a couple more seconds here. Do we have any takers, Chad?
No, we do not.
Okay. All right, and nothing in the chat as well, I'm informed. So, all right, well, thank you very much for joining us on a Friday afternoon. Again, that was Human Services Director Bruce Liggett. His last name is spelled Liggett, and we will be sending out a news release as well about this news conference and some of the information we provided today, so you'll have correct spellings and that sort of thing. So, as one final reminder, please put on your Twitter and your Facebook, remind people to fill out their census if they're stuck at home during this time. So thank you so much for joining us on this Friday. We will make you aware of the next media opportunity. And for those listening in on YouTube and Facebook, we've been trying to do this several times a week, and we'll try to keep up that frequency as we go through this together. Thank you very much.